So the behaviors we are going to target for skill acquisition, we're going to use functional communication to help Aubrey request the help when she is seeking attention. Aubrey will use a verbal or visual prompt, such as saying help or handing over a help card when presented with a task she finds difficult. Since Aubrey is in kindergarten and she is still learning how to read, ideally this card would have a picture of a student raising their hand and have this word help on the card as well. And also, if she needs a break, similarly, this would have a picture of a student requesting a break before leaving the classroom. Teaching Aubrey to request help is critical as it offers her the functional communication ability to address the need that she has in the moment without displaying the problem behavior of screaming and disrupting class with inappropriate vocalizations or leaving her designated area without permission. These skills can continue to help reduce her frustration, empower her with the communication skills to be able to advocate for herself and independently request assistance or breaks when she needs them. And this would overall help her to become more socially and academically independent as well. So the protocol for prompting this, for the prompting schedule, using most to least prompting for this skill acquisition will be as follows. So step 1, the RBT would use the verbal cue of help, the visual cue card. This is the objective. Aubrey will use the verbal cue help card and when she encounters a task that she cannot complete independently. And then the prompting hierarchy would involve most to least prompting schedule. So the goal would be to prompt Aubrey with the ability to request help, most to least prompting, starting with the most intense level of assistance and gradually decreasing levels of assistance until she is able to complete that skill independently. So first, the RBT would take Aubrey's hands and guide them to the help card and use a verbal cue to help Aubrey say help. Partial physical prompt would be where the RBT would lightly guide Aubrey's hands over to the help card whenever she needs help, or point to their own mouth, mouthing the word help, to encourage Aubrey to ask for help or to lift her help card when she needs it. The model prompt would be the RBT demonstrating saying help or pointing to the help card. So modeling it would be the RBT picks up the card and then Aubrey would pick up her own card, or the RBT would mouth the word help. Aubrey would then vocalize that she needed help. The gesture prompt, RBT would gesture or point to the help card, and then Aubrey would then pick up the help card, or the RBT would point and gesture towards the help card or could verbally ask Aubrey, what do you say when you need help? Aubrey would then say help. The verbal prompt, RBT would verbally remind Aubrey to ask for help if she seems frustrated. So if the RBT senses that Aubrey is beginning to show signs of frustration, she could verbally prompt Aubrey to say help or point again to her help card. And then finally, the independent prompt would look like Aubrey independently using the help card or saying help without any prompt. So this prompting schedule would ultimately enable Aubrey to independently request help or request a break, depending on her need in the moment, on her own without needing any prompting from the RBT or a family member or her teacher. So when Aubrey is beginning to develop these skills, and each time that she demonstrates this skill, we would offer immediate reinforcement, whether she is using a token economy or Aubrey has identified reinforcements that are appealing to her. Those would be given to Aubrey when she successfully requests a break or help. And as she continues to progress, the reinforcement would then shift to an intermediate schedule. So she would be, these reinforcements would be delivered on a set schedule in order to reinforce those behaviors. So we will know that Aubrey has mastered the skill acquisition and be considered proficient if she is able to request help or a break independently in 90% of the opportunities that she has over the 3 consecutive sessions that we are working with her. The protocols in this skill acquisition hierarchy align with my commitment to deliver effective, ethical, culturally responsive, compassionate, and empathetic interventions to my clients by using the prompting hierarchies and focusing on functional communication. This protocol would help allow Aubrey to learn this new skill in a supportive and patient environment, respectful and intentionally considering her needs and her pacing schedule.